I'm just recording it.
Welcome back to the fourth and final part of our lecture on healthcare in North America. So far, we've learned about how healthcare systems work in both Canada and the United States. And clearly, they are different. In this part of the lecture, we'll highlight some of those differences and more directly compare systems. We'll also finish by talking very briefly about Mexico, which in some ways combines elements of each of the other two North American healthcare systems. While Canada and the United States started out the first half of the 20th century with very similar approaches to healthcare, the two nations significantly diverged in the 1960s. Think back to part one and our discussion of Tommy Douglas's innovation with respect to government involvement, first in Saskatchewan, and then eventually the entire Canadian healthcare system. Canada adopted what is known as a single-payer, universal healthcare system. Governments, rather than private insurers, pay for all healthcare costs. The federal and provincial governments work together. Ottawa provides important funding to oversee national standards through the Canada Health Act, while the provinces and territories also provide funding and have primary responsibility for delivery and administration. All Canadians are fully insured, and medically necessary hospital and physician care must be provided free of co-payments or user fees. Particularly during the somewhat wild debate over healthcare reform in the United States, the Canadian system was held up as an example of socialized medicine gone wrong. Keep in mind that socialism is generally considered more a dirty word in American political culture than is the case in Canada.
But I'm doing it right now
Tommy
because then
Douglas was,
we
for
get this done
instance,
fast.
clearly inspired by democratic socialism, and the idea of universal health care is also inspired by that belief. But it's not really accurate to describe the Canadian system itself as socialized medicine.
And I have a lot to get done.
Unlike in Britain, which does operate on a system much more like socialized
There's
medicine,
3 questions to
private
this
sector
one question.
continues to play a role
And then I
in
don't know how
Canadian
many I'm going to
healthcare.
have after this because that's question set
Doctors
3, which
are
I have
clearly in the private sector,
5
still in
questions.
Canada. They
Possibly.
bill the government
It's just
for the
that-
services they provide, but they do so generally as
When did you
private
start
operators,
drinking?
not salaried employees of the state. Even Canadian hospitals are not technically owned by the government. They are typically operated by private boards and regional health authorities. Diagnostic services are provided often by private companies, but again, they bill the government directly for these services. And many Canadians also have supplemental health insurance provided by private insurers companies, sometimes as benefits tied to their employment. These cover medical costs such as prescription medications, dentistry, and other health-related services like eye care, naturopathic medicine, or chiropractic that may not be covered by various provincial health plans. So the private sector is still engaged in Canadian healthcare, but this is undoubtedly to a much lesser degree than is the case in the United States. There, efforts are increasing to ensure universal coverage, but as we've seen, this is done by compelling Americans to purchase health insurance, typically from for-profit insurance companies, and then reimburse medical service providers. At least, this is how it works for the majority of Americans who are not covered to some degree by a government-assisted health care program. And American governments do spend money on health care. It's not as though the public sector in the U.S. provides no funding at all, just the opposite. Estimates vary, but it's quite likely that the federal and state governments in America contribute in some way nearly half of the over $2 trillion spent annually on health care. There's tremendous debate as to which system is better, the Canadian or the American. In fact, there's so much debate that it's difficult to wade through all the evidence. Some of it's quite scholarly and good, and come to any sort of definitive conclusion. There are advantages and disadvantages on both sides of the border. One thing is certain, the U.S. spends more than Canada on health care, and the data is consistent here over time, and whether you measure spend either as a percentage of gross domestic product, or GDP, or on a per capita, per person sort of basis. Data from the Organization for Economic Cooperation and Development, or the OECD, demonstrates. In this graph, the blue lines represent Canadian expenditures, while the red lines represent American expenditures. You can see that on every measure, the U.S. spends more, sometimes significantly more. Of course, the next key question is whether or not that extra money being spent means that Americans actually enjoy a better system of health care. That is the quality of their health care better than is the case in Canada? This, too, is difficult to assess. Often, life expectancy data is used to assess the overall health of individuals in a country. You can see from these graphs that Canada enjoys a higher life expectancy in all categories when compared to the U.S. The blue lines are Canada, the red are the U.S., and the black lines are the OECD average. Notice that Canada is consistently above the OECD average, and the U.S. consistently below. Infant mortality is another indicator sometimes used, and here again, Canada scores better than the U.S. The difficulty with using these data indicators, though, is that there are significant differences in the racial composition of Canada and the United States, and obesity rates are also significantly different between the two countries. As a consequence, it's hard to use life expectancy and even infant mortality to provide a hard, fast, good, binational comparison for seeing how well the healthcare system performs relative to one another. The U.S. does spend more on medical technology like MRI and CT machines, increasing the accessibility of these to patients on that side of the border. And studies seem to indicate that Americans wait less time to see specialists than is the case in Canada. Data is less consistent on ER, emergency room, and family doctor accessibility and wait time. Americans may spend less time waiting to be seen by a doctor in an emergency room, but Canadians may have an easier time accessing primary medical care through their family doctor. This is especially so when you take into account the large number of Americans who have no insurance to cover such visits. In some ways, this is a little like comparing apples with oranges. In spite of some similarities, the two healthcare systems are fundamentally different. In the case of Canada, a political culture seems to have emerged that places more emphasis on the community as a whole, and the approach to national health care, to a national healthcare system, reflects that. In the United States, the emphasis is clearly on the individual. Each person is ultimately expected to take responsibility for his or her own health care. Even the most recent reforms to the American system still uphold this fundamental expectation. Before we end, I'd like to touch just very briefly on Mexico. The asymmetry in the nature of economic development in North America makes it really quite difficult to fairly compare Mexico with Canada or the United States on the issue of healthcare delivery. Still, it's worth making a couple of observations about how healthcare is delivered there. In some ways, it's an interesting, almost hybrid combination of the two systems that exist in the northern part of the continent. As in the United States, Mexicans can readily access private healthcare. If you can afford it, you can get care from private physicians at their offices and in private clinics or private hospitals. This is much more like the U.S. and not at all like Canada, where government rules make it quite difficult to obtain medically necessary care for procedures or medical problems on a private basis. Canadians would typically need to leave the country for such private care, and certainly a few in fact do. But Mexico, since 2012, has also officially achieved universal health care, more like Canada, not so much like the United States. Public health care is guaranteed to Mexico as a constitutional right, and both the federal and state governments contribute to health care. The actual delivery of health care, where one is treated, is somewhat dependent on employment status, where you work. But in the end, all Mexican citizens are eligible for subsidized health care, regardless of work status. Healthcare has proven to be a messy and complicated political issue in North America, especially so in the United States. It is interesting in and of itself as public policy, but it is also telling for us in this course as an indicator of not so subtle differences in political cultures across the continent. Think about what this tells us about the theme of divergence and convergence in NO 105. That's a point that we're sure to pick up on in class. Bye for now.
She's here. Jade. Jade. She's here. Jade.
Step over.